begin by commending Mark and Victor for the extraordinary leadership they've shown in bringing us to this point. This has been a remarkable project, and I think the work product itself speaks for the amount of effort and the amount of expertise and wisdom that collectively is reflected in the 19 documents. And let me compliment both Mike and Sheila. They've done such a good job of framing so much of what the message around these documents really portends as we look at health policy going forward. I'd like to spend just a couple of minutes talking about Vital Directions in the context of what's going on Capitol Hill right now. I think it's counterintuitive, but I would argue that there really isn't much of a debate about what it is we're trying to do. I think if you talk to conservatives or liberals, Republicans or Democrats, I think there's a general consensus that really what we're trying to accomplish is the creation of a high-performance, high-value health marketplace with better access, better quality, and lower cost. That's really, I think, what unites us. That is what we're trying to do. We all recognize we have serious problems with cost, access, and quality. And in all three areas, there are causes and there are solutions around those causes that ought to be addressed. The real debate is what is the role of government in getting there? And this roadmap that Vital Directions has laid out with these 19 papers, as Sheila and Mike have so properly described, is really our way of answering that question. How do you get there, and what is the role of government? There isn't a consensus around every single point with unanimity, but I think it's a debate that we've actually had for 100 years. And through many compromises over that whole century, we've come up with a $3 trillion public-private partnership today in health. That public-private partnership is a collage of subsystems. We really don't have a system. And as we look at this collage going forward, the Affordable Care Act was really the latest installment in this effort to achieve this question of what kind of a healthcare system, what kind of a collage of subsystems can we create in this $3 trillion public-private partnership. As I look at what's happening on the Hill today, surprisingly, it's really a very, very narrow focus. As you look at this, the whole spectrum of health policy that really has to be addressed, and my four colleagues on the panel have done such a good job of doing that, it's really, we're talking about two fundamental issues right now. How do we reform the individual market, and what do we do about Medicaid? And as we look at those two questions, as we consider the individual market in particular, I think the three fundamental issues that have to be addressed by Congress, Republicans and Democrats, is how do we accommodate better shared risk between the government and the private sector, number one. Number two, how do we create a pool that accommodates the need to address sick people in our society in a way that doesn't bankrupt the rest of everyone involved in health? And third, how do we make it affordable? Those three questions have perplexed policymakers for decades, for generations, and they aren't going to go away, and we aren't going to find a solution. But I think those are the three fundamental issues, and we've got to find ways to move forward on those questions if we're going to be successful in this round of the debate about the future of health and the individual market. On Medicaid, it's really two basic questions. Do we cap expenditures for the first time? And if so, how do we do it? And secondly, do we give states more autonomy, more flexibility, more responsibility in so many ways? That's an unanswered question as well. So as we work through those two basic questions, it seems to me that we have to realize as well that this isn't going to play out just in Congress. Congress is only one of 5 levels that will ultimately decide how this all is going to be decided. By far the most important right now is the statutory level and what we see happening each day and what we'll see again on Thursday in the House of Representatives. But the second is probably every bit as important, and that's the administrative and the executive level. There are 1,442 mays and shalls in the Affordable Care Act. If that doesn't give you a pretty good understanding of the autonomy the Secretary has to address these challenges independent of Congress, I don't know what will. But clearly, there is going to be an enormous amount of regulatory and administrative latitude here as these issues are addressed. The third is something that both Mike and Sheila have talked about a good deal, and that is the important role the states are going to have beyond the Affordable Care Act. I think in many cases, the degree to which we are dysfunctional in Washington is the open invitation for states to fill the void. And we're already beginning to see more and more of that as it plays out. The fourth level is the courts. A lot of these issues are going to continue to be contested, and we're going to see case after case come all the way to the Supreme Court, as we've already seen for the last 7 years. And finally, the final section is the private sector. And there is an enormous innovation explosion going on in the private sector that I find enormously exciting today. The Vital Directions papers addresses the opportunities and the challenges and the real sense of potential momentum as we look to addressing all of the challenges we face in health, thinking of those three goals. And I would simply end by something Sheila has emphasized, and Mike related to it as well. The only thing that we can be sure of that will ultimately be permanent health policy is something that gets the kind of bipartisan support that we've seen with other successful health endeavors in the last 20 years. We saw it with CHIP. We saw it with the community health centers. We saw it with MACRA. We've seen it with 21st Century Cures. We've seen it over and over again, and in those cases where there is broad bipartisan support, there is permanency. We didn't see it with the ACA. And if we don't see it this time, I guarantee you we're going to be back in 2 years or 3 years or 4 years having this debate and this discussion all over again. Vital Directions gives us an opportunity to say we can avoid that. Let's look at this roadmap. Let's do as much as we can to find the bipartisan consensus that is so necessary, and let's all make it our effort to attain that goal. Thank you.
Thank you. I think these are a round of applause.